Hello, my name is Zoe Szewczyk, and I'm a health research economist at the Hunter Medical Research Institute and a PhD candidate at the University of Newcastle, Australia. I was the lead author on this project, a systematic review of economic evaluations of antenatal nutrition and alcohol interventions and their associated implementation interventions, along with my colleagues, Associate Professor Elizabeth Holliday, Miss Brittany Dean, Professor Claire Collins, and Miss Penny Reeves. I'll begin by providing some background for this review. Health promotion interventions targeting pregnant women have the potential to improve maternal and infant outcomes in the short term and reduce the burden of disease across the lifespan. Specifically, poor nutrition and alcohol consumption during pregnancy have been identified as risk factors for adverse health outcomes during the antenatal period and throughout an infant's life. Improving maternal nutrition and promoting alcohol abstinence in pregnancy are key to reducing lifelong economic and social impacts to both mothers and infants. However, antenatal nutrition and alcohol interventions are underused, partly because economic evidence to inform best practice guidelines and support investment is limited. Greater understanding of the cost effectiveness of antenatal nutrition and alcohol interventions and their implementation strategies is warranted to inform future healthcare guidelines, investment allocation, and research priorities. The purpose of this systematic literature review was to assess the extent to which economic evaluations have been applied to antenatal public health interventions and implementation strategies addressing maternal nutrition and alcohol intake. Two separate systematic reviews were conducted to address two research aims. The first was to identify empirical economic evaluations of antenatal public health interventions targeting nutrition and alcohol, published between January 2000 and May 2019. The second was to identify empirical economic evaluations of implementation strategies of antenatal public health interventions targeting nutrition and alcohol intake. The third aim of this review was to then synthesize the evidence to develop recommendations for the conduct of future economic evaluations. Both reviews adhered to PRISMA guidelines and a pre-prescribed 5-step approach for preparing systematic reviews of economic evaluations for informing evidence-based healthcare decisions. The searches were conducted across 6 databases and were accompanied by a hand search of the grey literature. The PICOS criteria and Medline search filter are available in the published manuscript. After duplicate removal, title, abstract, and full text screening by 2 independent reviewers, Review 1 returned 12 economic evaluations, 10 of which were nutrition interventions and 2 were alcohol interventions. Review 2 identified no economic evaluations of implementation strategies. Methodological quality was assessed using the Drummond 10-point quality checklist and the Consolidated Health Economic Evaluation Reporting Standards, or CHEERS checklist, was used as the data extraction template. Pooling of economic evaluations is not recommended due to likely sources of heterogeneity. The review found that methodological quality was high, with variation in reporting practices, a predominance of modelled evaluations, and supplementation interventions, and there was no consideration of the cost of implementing interventions into practice. Health promotion interventions have the potential to reduce healthcare costs. The application of economic evaluation to health promotion interventions is increasing, but its application to implementation interventions remains uncommon. Assessment of the effectiveness and cost-effectiveness of nutrition and alcohol interventions and their implementation strategies is necessary given competing claims on health budgets. Furthermore, ensuring effective and cost-effective implementation is essential if governments are to achieve improved population health and contained per capita health expenditure. Despite this need, there is an absence of the evidence of total cost and cost-effectiveness of antenatal nutrition and alcohol interventions and their implementation strategies. The true cost of realising the associated health benefits to pregnant women, infants, and the health service remains unknown. Incorporating health economic principles and methods into health promotion interventions will inform decisions about how to derive value from investment in health promotion and health care. Thank you for listening to our presentation. If you have any questions or comments on this presentation, please address them as a comment below the video. We will read and respond. Alternatively, you are welcome to email me directly with any specific questions. This manuscript is due for publication with Nutrition Reviews, a top 10 nutrition journal, later in 2020. Thank you for your time.